Hey, good evening, everybody. My name is Craig Mullen. I'm a nurse practitioner with Atlantic General Hospital in Berlin, Maryland, and I'm just stepping outside tonight to take a little walk around the neighborhood, get some physical activity. During this time of year when it's a little bit colder and the days are shorter, it's real important to do what you can to stay healthy. So we'll also be talking about the topics of influenza and COVID-19 as well in this video. So I hope you enjoy, and thanks for hanging out. This video is for Atlantic General Hospital and for the local community that we serve as part of our contribution to the National Walk with the Doc organization.
Let's talk about influenza. Influenza is an acute respiratory illness caused by influenza A or B viruses that occurs in outbreaks and epidemics worldwide, mainly during the winter season. In the USA, flu season extends from October through March, though cases may still occur as late as April and May. Influenza is most prominent between the months of December and February. It is a potentially serious disease that can lead to hospitalization and sometimes even death. Signs and symptoms of upper and/or lower respiratory tract involvement are often present, along with indications of systemic illness such as fever, headache, muscle tenderness, and weakness. Infection with the flu may be acutely debilitating, but is generally self-limited within the general population. Influenza is associated with an increased morbidity or burden of disease in high-risk populations, such as those who are advanced in age, immunocompromised, or the very young, such as infants and toddlers. Infected individuals do carry a large amount of active influenza virus in their respiratory secretions. While coughing and sneezing expel large droplets across short distances, aerosolization of infectious virus particles does occur as well and allows for transmission to occur over distances greater than 6 feet. Even the simple act of unmasked breathing in the absence of coughing and sneezing has been identified as a means of transmission of the virus between individuals in close proximity. After infection with the influenza virus, there is an incubation period that takes place over the course of 1 to 4 days prior to the onset of symptoms. A majority of individuals begin to experience symptoms of illness 2 days post-exposure. However, it is important to note that replication and shedding of infectious virus begins up to 24 to 48 hours prior to the onset of symptoms, and during this time, an infected individual can spread the virus to others before they start to feel significantly unwell themselves. Individuals infected with influenza are, on average, most infectious on day 2 following their exposure, but they may continue to replicate and shed the virus for up to 7 days. For this reason, individuals who are infected with the influenza virus, either A or B, should remain home from work, school, and other community-related activities for at least a full week. In individuals who have chronic illness, are immunocompromised due to disease state or the use of immunosuppressive therapies such as systemic glucocorticoids, the infectious period may last longer, sometimes up to 2 weeks, and in rare circumstances, perhaps even 3 weeks. As a general rule, individuals who are experiencing more severe symptoms tend to shed larger amounts of virus. Influenza illness often begins abruptly with the onset of fever, headache, generalized body ache, and fatigue. Associated symptoms including runny nose, sore throat, and a dry or non-productive cough are often present as well, and these are a reflection of respiratory tract involvement. The range of symptoms is relatively variable, as some may report only common cold-type symptoms, while others may experience only fatigue, weakness, dizziness. Older adults in particular may express more subtle signs of illness. Gastrointestinal symptoms such as nausea, vomiting, and diarrhea may present in up to 20% of children with the infection. Treatment for the flu involves supportive therapies including rest, adequate hydration, and the consumption of clear fluids, as well as Tylenol and anti-inflammatory medications for fever and pain as needed. Patients may also benefit from various cough and cold preparations, as well as saltwater gargles for sore throat, medicated throat lozenges, and nasal sprays. Commonly, if diagnosed with the flu as an outpatient within 48 hours of symptom onset, you may be prescribed an antiviral medication known as Tamiflu. This medication works to limit the spread of influenza virus throughout the body, and it has been shown to reduce both the severity and the duration of the illness. With influenza, there is a substantial risk for more complicated course of illness, typically involving one or both lungs and resulting in pneumonia. Individuals whose symptoms progress over the course of several days to weeks instead of resolving are most at risk of experiencing this sort of complication. Viral pneumonia is the least common but the most severe complication of acute influenza. There is also the risk for secondary bacterial pneumonia. This is frequently seen in individuals who experience a sudden worsening of fever and respiratory symptoms after initial improvement of other flu symptoms. The fever is often higher than it was during the initial phase of the illness, and cough may be productive with thick, discolored sputum. Complications of influenza in the severely ill may further include mixed viral and bacterial pneumonia, opportunistic fungal infection of the lungs, and worsening pneumonia leading to respiratory failure, sepsis, and potentially organ failure as well. Additional cardiac and neurologic manifestations of disease are often noted in this population as well. The best way to protect yourself from the flu is to get an annual influenza vaccine. The influenza vaccines include trivalent and quadrivalent options. The trivalent vaccine protects against two influenza A viruses, H1N1 and H3N2, as well as one additional influenza B virus. The quadrivalent vaccine confers protection against these three viruses as well as an additional influenza B virus. It is my recommendation that you speak with your healthcare provider about which option is best for you, especially if you are over 65, in which case you may qualify or be best suited to receive the high-dose quadrivalent vaccine. Generally, the flu vaccines are adjusted annually based on estimations of which viral strains are going to be the most prevalent during the upcoming flu season. In the first couple of weeks after vaccination, the body's immune defense system produces antibodies to the flu viruses present in that year's vaccine. These antibodies help to prevent infection. You cannot get the flu from the flu vaccine. While the flu vaccine is not always 100% effective, it is very important to receive the vaccine because it will cut down on the severity of the illness that you experience, as well as possibly cutting down on the duration of your illness. Children as young as 6 months are eligible to receive the vaccine, and it is recommended for all adults who do not have any contraindications to the receipt of the vaccination. All right, and now we're going to talk about COVID-19. COVID-19 is a disease caused by SARS-CoV-2, that is severe acute respiratory syndrome coronavirus 2. It is the cause of the current global pandemic. SARS-CoV-2 is one of 7 coronaviruses known to infect humans. 4 of them contribute to the common cold that we often experience in winter months. The additional 2 coronaviruses contributed to outbreaks of severe acute respiratory disease during the SARS and MERS outbreaks of 2003 and 2012, respectively. As of today, in the USA, we are experiencing a very high burden of illness due to COVID-19, with anywhere from 180 to 300,000 new cases daily and roughly 2,000 to 4,000 deaths daily. The disease is highly transmissible, and there is a great degree of variability in how individuals will experience this infection. While it has been estimated that anywhere from 17 to 20% of individuals infected with SARS-CoV-2 will experience an asymptomatic course of illness, almost 50% of those initially defined as asymptomatic do go on to develop some degree of symptomatic illness. Currently, it is still very much under investigation the degree to which asymptomatic individuals transmit the virus to others. While the SARS-CoV-2 viral loads of asymptomatic and symptomatic individuals are very similar, it has been determined that the length of time that infectious viruses shed is shorter in asymptomatic individuals when compared to those with symptoms. Therefore, we can presume that asymptomatic individuals do not transmit the virus to others to the same extent as those who are symptomatic with the illness. As with the flu, coronavirus is also predominantly spread through respiratory droplets and aerosolized particles during breathing, talking, singing, sneezing, and coughing. Small aerosolized particles may remain suspended in the air for extended periods of time, making indoor settings and poorly ventilated spaces areas where viral transmission may occur. Inoculation with the SARS-CoV-2 virus occurs when it is directly inhaled into the respiratory tract via the mouth or the nose. To a lesser degree, it is also thought that infection can occur through the mucosal tissue of the eyes. Surface contamination is not a primary means of transmission. Following exposure to SARS-CoV-2, there is an incubation period of up to 14 days prior to the development of illness and the onset of symptoms. A majority of individuals who acquire the infection do develop symptoms between days 4 and 6 post-exposure. Some of the most commonly reported symptoms include fever, chills, fatigue, muscle and joint ache, headache, dizziness, sinus pressure, sore throat, dry cough, shortness of breath, chest discomfort, nausea, reduced appetite, and loose stools. Another exceptionally common and strange symptom is the dramatic loss or alteration of sense of taste and smell. Infrequently, some patients may also develop dermatologic complications such as rash. Again, the spectrum of illness is highly variable between individuals. The U.S. Centers for Disease Control and Prevention state that after an exposure, defined as at least 15 minutes of contact over a 24-hour period within 6 feet of an infected individual, persons should initiate a self-quarantine, ideally for the full 14-day period or incubation window. If symptoms do develop, testing is promptly recommended. For those who have tested positive, a strict quarantine involving home isolation is required. Patients must quarantine for at least a full 10 days from the onset of their symptoms or, if asymptomatic, from their test date. Quarantine can end once a patient has isolated for at least a full 10 days and has a period of 24 hours where they are symptom-free. The risk for severe COVID-19 is a major concern. Individuals who are advanced in age, immunocompromised, or have underlying comorbid conditions such as obesity, diabetes, hypertension, kidney or liver disease, or heart or lung disease are at particular risk of experiencing more severe course of illness. Further, it has been found that the ratio of severe COVID-19 in men to women is roughly 3-to-1, indicating that male sex is in and of itself a risk factor for more severe disease. Complications of severe COVID-19 occur when damage to the tissues of the body from the virus itself is present in the setting of an exaggerated immune system response to the virus. Such complications can include respiratory distress and failure, in some instances requiring mechanical ventilation, as well as cardiac arrhythmia, acute cardiac injury or cardiomyopathy, thromboembolic disease involving at times disseminated coagulation, pulmonary embolism, or stroke. Also, there is a risk for the development of acute kidney injury and kidney failure, as well as impaired cognition, sometimes delirium, and a multi-system inflammatory syndrome, which has been described as an infrequent complication identified most predominantly in children several weeks following their recovery from the illness. Over the past year, our understanding of the COVID-19 disease process has greatly increased. In the outpatient setting, supplementation with certain medications, vitamins, and minerals has shown promise in treating the illness in those who are mildly to moderately symptomatic. Alternatively, healthcare providers in inpatient settings have developed protocols for treating the virus and the myriad of multi-system complications that can occur due to the infection. Therapies that may mitigate severe disease have been identified, but it is not always a guarantee. It is important to remember that this is a novel virus. The unknowns still greatly outnumber the knowns, and the long-term implications of infection with SARS-CoV-2 have not even had a chance to be investigated. Meanwhile, reports do continue to amass regarding the potential for long COVID or long hauler syndrome, which has been purported to affect many who have recovered from the acute phase of the infection, including thousands who were only mildly symptomatic during the initial disease process. Some of the most profound complaints associated with this long hauler syndrome include, chronic fatigue, brain fog, insomnia, headaches, shortness of breath, and symptoms of dysautonomia involving sometimes comparatively dramatic fluctuations in body temperature, blood pressure, and resting heart rate that persists sometimes months after the initial disease process. So the bottom line, please continue to do your part. Socially distance, Wear your mask in public spaces always. Quarantine yourself if you know or suspect that you have had an exposure event. Practice the fundamental transmission-based precautions such as hand hygiene and hand sanitization. It is so critical that we achieve herd immunity here in the United States. So when this vaccine becomes available, please avail yourself of the opportunity to receive the vaccine. We're gonna get through this, but we need to do the right things. Be a hero, do the right thing. Thank you so much for your time. I hope that this was an informative discussion. And again, thank you so much for tuning in.